A common way to treat sports injuries is with RICE: rest, ice, compression, and elevation. Usually this gets you back on your feet, particularly if you RICE diligently for the first 48 hours after an injury. Stop doing activities that aggravate your injury. If you sprain your ankle, don't try to walk it off. Rest can often mean the difference between an injury that heals right away and one that nags you for months. But don't use your injury as an excuse to quit exercising. Simply choose an activity that doesn't hurt. If you pull a hamstring, you can still do upper body weight training. Ice reduces swelling and deadens pain by constricting blood flow. Put a thin, damp washcloth between your skin and the ice. Then apply ice with a pack, a plastic bag full of cubes, or a package of frozen corn. Ice for 15 to 20 minutes 3 or 4 times a day for as long as you feel pain. A favorite icing technique is ice massage. Fill a paper cup 3/4 full of water and stick it in the freezer. When the water freezes, peel the cup down and use this to massage the injured area in a circular motion for as long as you can take it, usually 4 or 5 minutes. Ice massage penetrates deeper into your muscles than just throwing on an ice pack. Put pressure on the injured area to keep the swelling down. Use a damp ACE brand bandage or buy a special wrap or brace. Wrap it tightly enough so that you feel some tension, but not so firmly that you cut off your circulation or feel numbness. Elevating your injured body part reduces swelling by allowing fluids and waste products to drain from the area. If your ankle is injured, you don't need to raise it too high. Just prop it up on a couple of fluffy pillows. Elevation works best when used in conjunction with the rest of the RICE treatment.